As we continue to navigate the coronavirus crisis together, of course, we want to keep you informed. WBZ is the only local TV station with a doctor on staff. Dr. Mallika Marshal joins us now. And Mallika, we want to get right to some of our viewer questions. So let's get right to Tara, who asked on Facebook, I live a quarter of a mile away from a testing tent and it's very windy where I am. Can the wind carry the virus to my area from that testing tent?
So you're right. We're not exactly sure how far those tiny little respiratory droplets can travel, possibly a foot or more, 12 feet or more, but we don't really know, but certainly not a quarter mile. And most of those droplets are going to be contained within the testing tent, and those that might possibly escape are going to quickly be dispersed. And in fact, the more ventilation you have, the better off you are, because the virus is less likely to pose a risk.
All right, now Cindy asked an interesting question on Facebook. She asked, now that mosquitoes are active, I saw some over the weekend, can they transfer COVID-19 from person to person?
I know, and I saw some ticks too out there. No, the virus is not transmitted by mosquitoes, things, not like West Nile or Triple E. And so it's transmitted person to person through respiratory droplets. But you're right, as the weather warms up, we do need to worry about those ticks and mosquitoes. So something else for us to think about.
All right, now this is an important question because I think people are really itching at this point to see their loved ones. This is Kathleen on Facebook, who says, I have self-isolated since March 17th with my daughter. Neither one of us has had any symptoms. Can we now spend some time with my 88-year-old mother, who has also self-isolated with no symptoms? So they're coming up on almost a month of being self-isolated.
I know it's so hard, and I haven't been able to see my mom either, but I would say, if at all possible, don't. Even though you don't have any symptoms, if you've gone out to the grocery store or had to run any errands, you still don't know whether you could possibly become infected, and your mother is 88 years old, so she's in a high-risk group. So if I don't know if she lives in a house, maybe you could do a drive-by or stand on the sidewalk and wave to her, but I think you should try to wait at least for another few weeks until we know exactly which direction we're going in.
Yeah, it feels like you make one trip out to the grocery store and you never know if you're sort of restarting the clock. Cherie asks, any chance the media could start focusing on the positive, like how many people recover, as opposed to the death toll every day? This is an interesting question, Mallika.
And I get it, because we're all craving some good news right now. I have to say, I have seen some very sweet stories about people who have left the hospital who are recovering from the virus. But those numbers in terms of how many people are infected, the hospitalizations, ICU bed admissions, how many people have died, those are really important numbers for the public health officials to keep an eye on, so they can decide when we can start loosening restrictions. And they're also a really important reminder to the public of why it's so important to shelter in place. So I know it's hard to hear the numbers, but sometimes we just have to.
And by the way, Doctor, we should point out that the state, and the governor made this very clear a couple of weeks ago, he was asked about it, the state doesn't track how many people have been recovered, because after people are better, they're not required to actually go back to the state and say, I'm better now. But Johns Hopkins University estimates that more than 43,000 people have recovered in the U.S. So we don't have a state number, but we know 43,000 across the U.S. Thank you, as always, Mallika, for your information. It's always great.
My pleasure, David.
All right, we hope
Good to talk to you.
Hope to see you soon in person.